Good afternoon. My name is Terence, Delehanty, your police chief. I'm here today with Meredith Hurley, the Director of Public Health. We're here to update the community on the Covid-19 epidemic. The last time we were here was about 8 weeks ago, and we were starting to see increases in cases, and we saw decreases in cases, and now we're starting to see another spike here in our local community. So Meredith, if you would be so kind to take us through your data and what you see the trends are currently, would be greatly appreciated. But before you get started, I just want to recognize all your hard work over the last 12, 13 weeks now. And we worked closely at the EOC, which we were able to close down. And now we're back. I'm back at the police station, and you're back at the health department. But we're still working in a collaborative effort. The police department is taking a secondary role, and the Board of Health has always had the primary role. And but we're still, as the fire department, the police department, EMS, working closely together to make sure this epidemic does not spike again here in Winthrop. So thank you for all your efforts. I know it's weekends, 10 o'clock, 11 o'clock at night, we're sometimes talking. So I know your pay does not reflect your effort that goes into your work. So thank you, and if you don't mind bringing the community through what you're seeing.
Sure, and you know, I have to reiterate also that this has been such a wonderful collaborative effort for the community that we've been able to pull together in a multi-sector kind of approach, and that's worked really well for us. So we're here today definitely because we've seen some concerning trends since the beginning of July. We're now at July 17th. So to give everybody an overview of the current response for COVID-19. So since March 16th, we've had 289 confirmed cases, of which we've had, unfortunately, 24 people that have passed away from COVID-19 here in Winthrop. 228 of these people have recovered, and we currently have 37 people in isolation. On a month-by-month trend, in March we saw 27 reported cases. April was by far the biggest spike that we had. We had 138 cases in the month of March. May, we had 61 cases. In June, we were relatively quiet with only 15 cases. And the unfortunate thing and the concerning part is that so far in July, we've had 48 cases reported to the local Board of Health. So we know that the reopening has definitely impacted the increased cases here in the town of Winthrop. We expect that. We expected to see an increase in cases here in Winthrop as people begin reacclimating into the community and doing more with more at restaurants and doing more socializing. But the socializing is probably what is driving a bit of the increase that we want to really reiterate to people how important it is and how to safely continue to conduct ourselves within the community and for our families. The increased congregation is definitely driving these numbers.
You said in April, you had how many cases in April?
In April, we had 138 cases. 138,
and that was our largest quantity of cases throughout this whole epidemic.
Yeah.
And so from July 4th forward, how many cases have you seen in July?
We've had 48. So the first case was reported for the month of July, was reported on July 4th. So in the past 13 days, we've had 48 cases.
So we're on track, if we keep trending this way, by the end of July to meet or beat our April highest month in this case, which back then we're really getting familiar with the protocols in place and everything else. So I guess everyone's going to what's driving this? You do contact tracing. So could you tell us in your experience, and then I'll tell you what I'm hearing on the street of what I think may be driving it.
Sure. So the real difference, an important point to this is that we have definitely seen an uptick of cases in those under the age of 18. They're not all of our cases, not all of the 48 cases that have been reported through July, but they constitute about 50% of them. So whereas, for example, In April, when we had 154 cases reported, I only had 8. Only 8 of them are under the age of 18. And now I have 21 cases under the age of 18 for July only. So in April, we were under the stay-at-home order. Now we're in the phase of it being safer to be at home. So I think that, kids are out a little bit more. Kids are definitely out more. And we also have to balance that with mental health, right? So we know just being at home, stuck at home for months on end is not beneficial either. But I think that there's ways that we can improve how we're interacting and how we're, going out and playing or using outdoor spaces, and how we're utilizing the restaurants, and the protocols that are in place. And, we can go through the community and shut down. If we were to take a step back, we don't want to see what we're seeing in other states. We don't want to see a reclosing of businesses. We don't want to see a reclosing of outdoor spaces. So what we have to do is just really evaluate our behaviors again and make sure that we're all following the protocols, because they really are based in science and they're helping. It got us to this point where we saw this decreased trend. So now we have to just kind of re-educate ourselves and remind ourselves as a community of what we need to be doing.
So that's a great point on behavior, because I'm hearing there's behavior out there that has been made known to me that is driving these numbers. And those behaviors obviously are focused around the 3rd and 4th of July weekend, where we had some people having these large parties in their backyards.
Yes.
And some people are having kids at their homes that are sharing vapes, and other activities that might not be responsible, legal, or otherwise as well, with juveniles drinking perhaps. So the calls that we've been on, we haven't seen the kids drinking in those houses, but certainly I wanted to bring it up because that's the information I'm getting in. And I think everyone, when we went to stage 3 here, phase 3, kind of let their guard down.
I think so too.
So what's the advice that we want to get out there today to these people, to everyone, kids, parents alike, because parents need to play a very important role in this if we're going to stop this from continuing to go up.
Right.
They need to take responsibility for what's happening in their homes or on the beaches behind their homes,
Right.
And try to help us stop and isolate the spread.
Yeah.
So again, we still have a mask order in place when they're in public places. And what is a public place, I guess, will be the question that we get.
Yeah. So anything outside of the home, even the open space, if you can't keep 6 feet distance between you and another person, even if you are outdoors, you should be wearing a mask. Masking has been shown. Mass General Brigham just came out with a great study, a vetted study this week about the importance of masking and how it helped transmission within their facilities, which they were kind of internally tracking, but we know that masking definitely prevents the transmission of COVID-19. And so that's a good practice that we all need to be.
If I'm on the beach and I'm out there, if I'm not 6 feet apart from somebody, I need to have a mask on.
Unless that person's in your household and you've been existing with that person. If it's somebody that is not in your household, if it's you and 8 friends sitting on the beach and you all want to sit close-ish together, so that you either are there's music or there's this, or you just want to be closer to your friends, you have to wear a mask, because that's the area that that's the kind of activities that we're seeing spread with.
And you said if they've been in your home. That doesn't mean my friend who's been in my home.
No.
That means anyone I live with in my home.
In your home.
I can sit closer than 6 feet on the beach. But if I bring a friend, we have to be 6 feet apart.
Yes.
Unless we have masks on.
Unless you have masks on.
I'm walking down Shore Drive, and I'm coming within a close distance. I should put a mask on for the people who are passing.
Yeah.
Once they pass, I can take it off until I meet the next person.
Yep. Or if you can, go wide, right?
Yes,
so I run a lot, and I can't really run with a mask because I am old and it's hard enough to run. So what I do is I, will position myself. I choose to run early in the morning where there's less people and it's cooler anyways, but I will veer off out of respect for people so that, so you can either mask or you can physically distance yourself from somebody.
Now, I've heard that in some of these cases, they might have been sharing drinks.
That's a very risky behavior.
Yeah, so no one should be sharing a drink, a bottle, a thermos, whatever it is.
Right.
At this point, even if they are close contact.
Right, even if they're close contact, please do not share a drink. Even as a mom, knowing that when I'm cooking for my kids, you take a bite off of their plate or this, I've assessed those behaviors of sharing food even with my own kids, because it's just, good practice to get into. The sharing of food and the sharing of drinks, whatever the capacity, is very much discouraged. We worry about with youth, what we assume and what's been validated through some of these cases is that if there's a group of kids that maybe bring a amount of either alcohol or it doesn't even have to, it's alcohol or drinks or food, and there's not enough for everybody, they're splitting it. Don't split any food, don't split any drink. Assume that the person that you're next to could be the next carrier of COVID, because it takes a while for the symptoms to show.
How long?
Symptoms can show up from 2 days up to 14 days. And in the investigations that I've done, the majority of cases usually show between 5 and 6 days, 2 to 5 days generally. But then we've had a fair amount of people that, especially through this month, that have been asymptomatic, which is wonderful because, wonderful in the terms that we're not seeing people on ventilators, we're not seeing people quite so sick as we saw through March, April. It got a little bit better in May. But, so with asymptomatic, folks may not even pick up on it.
Okay. And if you're asymptomatic and you test positive, you still have to isolate for the required period of time.
Yep, it's a little bit shorter. So what the guideline is now is if you're asymptomatic and you remain asymptomatic, you need to isolate for at least 10 days.
Okay. I know there's been some anxiety within the community as the trend has spiked upward. And that anxiety is a rush to get tested, which will also help contribute to finding out what's really going on. I know it'll make us do more tracing and tracking of people. So if I'm sitting home, I'm listening to this, should I run out and get tested, or when and why should I be tested?
Okay, so that's a great question. I've heard that a lot in the last 2 weeks. So if you were a close contact with somebody that has tested positive or is showing symptoms of COVID, then definitely get tested. So there are kind of these two areas where I think people have gotten tested in the last few weeks. So it's either out of an abundance of caution, people have gone and got tested. The governor has stood up testing sites throughout the Commonwealth for these hotspot areas, and it's free. There's one in Lynn and there's one in Chelsea that anybody who's asymptomatic can go. Anybody can go, but you don't have to be symptomatic, and you don't have to be exposed. So there's that group of people. But then there's also the group of people that have been a known contact to somebody who is tested positive or is showing symptoms and has been tested. And so that's that. So I guess it's good to also, there's been a lot of questions about what is a close contact.
Well, I was just going to ask you that. What is a close contact, and what does that mean? Who's involved in that, and how do you trace and track that?
Right. So a close contact is not somebody that you happen to walk by and not have a conversation with. So close contact is somebody who, so it's somebody who you've had interaction for about 5, 10, 15 minutes in an area of less than of 6 feet while unmasked. So that's the interaction that we're most concerned about. So included in that would be somebody who's tested positive for COVID in the last 2 days, somebody who has had symptoms of COVID-19, has cared for somebody who has COVID-19, or somebody that you've had direct contact with, including hugging, kissing, or sharing eating utensils.
Which all of those things you just mentioned, we should not be doing.
Right.
Whether it's a funeral, although we want to pay our respects, but we shouldn't be hugging people.
Yeah.
As we go through those lines in church, we shouldn't be hugging or doing the sign of peace with our fellow parishioners.
Right.
So if we remind everyone that we shouldn't be doing that to begin with, we shouldn't have to worry about a close contact. But the close contact boiled down here is longer than 15 minutes, less than 6 feet,
Yep.
without protective equipment on.
Yep, exactly.
So if you close contact with a mask on for 15 minutes, it's not going to be a close contact.
Right. There's still a risk there, but it's a much lower risk. Much lower risk.
I think that's helpful that try to make people understand that.
Yeah.
What symptoms should they be looking for? If they, so I'm sure if you're symptom based, you want them to be tested.
Yeah, exactly. So, interestingly enough, the symptoms for COVID are very broad, and they mimic a lot of other things. So they mimic seasonal allergies, like if you're having a runny nose. So the symptoms are runny nose, cough, fever, any sort of respiratory congestion, GI symptoms, nausea, vomiting, diarrhea, headache. How we classify it is an unusual headache. So because a lot of people have headaches at baseline, so we say a headache that is not your norm. And kind of the key one that seems very unique with COVID has been a loss of taste and smell. Now, none of these symptoms are always happen to everybody. It's different for every single case. I've had some cases that have reported, body aches and malaise and some diarrhea. No cough, no fever, none of what was known to be a more traditional presentation of COVID at the very beginning. But throughout all of these 289 investigations, what really sticks out is when people start to lose their smell and taste. That seems very unique to COVID. And it's difficult, like I was saying, like around allergy season or, and of course, I think you and I have gone through it throughout this whole thing where, you start to have a runny nose and you think, oh gosh, is it COVID or is it this? Or,
I agree. So it's very important to know your baseline.
Yep, you have to assess your body.
If this is something that's happened every year for the past 5 years, more than likely it's seasonal allergy. And if it hasn't and you have these symptoms come on, then you should really reevaluate and talk to your primary care physician about it. If not, go to one of these sites to get tested.
Yep.
So I go to one of these sites and I get tested. I come down and I'm a positive. They report me to you.
Yep.
What do you do to me? Everyone's a little confused in the language of quarantining and isolating.
Right.
So could you walk us through that?
Sure.
If I'm tested positive, what's your response as a public health director?
So first of all, if somebody has gone and gotten tested, I think it's important for them to do a quarantine until their test results come back. The testing has been inconsistent with the reporting. Some places will report back within 24 to 48 hours, and some facilities are reporting, even today I got a test result 8 days later after.
Which makes your job incredibly hard to do if you're getting these results 8 days later.
Right.
Especially if the person didn't isolate.
Right.
But that's a long period to be isolated for. So does that make it almost impossible for us to do tracking and tracing?
I think if I'm hoping that when people go to testing sites, they're given that information. I don't know if that has been consistent throughout, but if you're going because you're symptomatic or you've been in close contact with somebody, I really isolate because sometimes I had just shared this, that we're having difficulties with some of the testing facilities with their IT uploading it to DPH. So I get test results sent to me from DPH through a specific system, which is how I know of confirmed cases here. So after somebody tests positive, it's a rush for time. I've said on more than one occasion, my experience with COVID is, waking up every day and fighting an enemy that you can't see. You don't know where it is, and the only way I know where it is through confirmed case reports from DPH. This community has been excellent reaching out for concerns and asking advice on quarantine and self-reporting quarantine or self-reporting positive results before they're in my system that I can access. So, but back to your question about quarantining. So quarantine prevents the spread of the disease that can occur before a person is known that they are sick. So quarantine and isolation. Quarantine applies to people that have not been confirmed positive. Isolation is for people that have had a confirmed positive case. So in order to quarantine, people should be staying in a separate area of their house, not to go outside of the home except for medical appointments, do not go to the workplace, and do not invite people into your home. Within the home, if you're living in a household with other people, ideally it would be that you are that you're able to stay in a bedroom, ideally have your own bathroom. These are ideal criteria. Ideally have your own bathroom and not be in a congregate space such as the kitchen, have food brought to you, dropped at your door, not launder your bed sheets or your clothing with the other laundry of the household. That should be kept separate. And kind of continue the quarantine for 14 days. Isolation is the same. It's just with a known confirmed case. So that being said, I know it's not always ideal for people. During the height of COVID, we were using a hotel, the Quality Inn over in Revere, for some of the families that really had multiple generations in their household, and it was really hard. That facility is not up and running anymore, so people do get creative if they have the opportunity to really isolate with it, either within the home. If that is absolutely not, I just suggest to people wear a mask. Everybody in the house should be wearing masks, and those high touch areas, those doorknobs and those light switches in the bathrooms need to be bleached after every use. That's the best that we can do at times.
Okay, and everyone's in a different economic situation, and certainly these epidemics cause more financial stress on people, and we're not trying to make it more difficult on the people that can't do this, but a mask only needs to be worn if there's a positive in the house and I can't isolate or quarantine.
Exactly.
In a separate area of the house and with the use of my own bathroom.
Exactly. And it's also, I need to mention this too, if somebody has tested positive in the household, everybody in the household then needs to quarantine, meaning they need to also stay in the house and stay away from the public for 14 days because household spread is the highest transmission rates that we see.
Okay, so quarantining means that I don't have to be isolated to a particular area of the house, just the house itself?
Yes.
And I don't need a mask for the quarantining. Isolation, someone needs to actually have their own separate room.
Yes.
Or a downstairs apartment or whatever the case may be, if you're so fortunate enough to do so, and if you're not, masked inside that home. I know the question is going to come up, and if Meredith Hurley wants to get tested, she knows where the best spot to get tested is. Where do you see the best spot to go to get a test with the fastest results?
With the fastest results. So the facilities that are turning around test results fairly quickly in under 48 hours have been Beth Israel in Chelsea and also Mass General in Chelsea. Both of them have the drive-up option, or you can call ahead and make an appointment. So from my perspective, I know that with the influx of testing from Winthrop residents in the last 10 days, they were definitely burdened, and the wait times were longer. But the feedback that I got from folks that called ahead and made an appointment, they were in and out in a much shorter amount of time. East Boston Neighborhood Health Center at their Paris Street location usually is able to turn around results in about 48 hours. So, and I'm sending people specifically to the Paris Street, and I believe that that's a call ahead and make an appointment facility.
Good. Now we know there's multiple tests out there.
Yes.
There's the rapid test. There's the antibody test. What should I be looking for? Should I be doing a rapid test, or should I be looking for the antibody test? What's your advice?
So the rapid test, I feel like, can give a false sense of security to people. If you are a known contact, close contact to a confirmed case, even if your test results come back as negative, you still need to quarantine for the 14 days because it might take a few days for the we call it a viral load to increase enough for the test to pick up that you actually do have COVID. So rapid testing, I've read different numbers, so I can't really put my finger down on how efficient it is or how accurate it is. I am worried that there are people that have been in close contact, go and get a rapid test, get a negative, and then feel like everything's fine. If you've been in close contact, you still have to do a 14-day quarantine. The other two tests that you were talking about, it's called a PCR test. That's the nose. It's generally a nasal swab that most people are having done. It goes right up the nose. It's a little uncomfortable. Some people say, you're tickling my brain. It goes into the membranes where you're at the top of your nose. So that measures the presence of the virus. So it doesn't tell us whether or not somebody is infectious at that moment. It's not sensitive enough to know that, but it just measures the genetic material of the virus in the nares. So, sometimes people will continuously get tested after testing positive, and we've seen people for upwards of 30 to 40 days test positive. They're not infectious. It's just measuring that the virus genetic material is still within their system. The other one that's gotten popular lately is the antibody test. So that is a blood test. It's a serum test. So there are two separate antibodies that are being measured, and it depends on which facility is running it, what kind of test it is. I'm not recommending people go and get an antibody test right now because we don't know what it tells us. So yes, it tells us that Terence Delehanty has the antibodies to COVID, but based on that information, I can't tell you when you had it. I can't tell you if you should be quarantining right now. Ideally, if there is an antibody test done, it should be done with the viral swab as well, so that we know if the virus is still present in your system. And also, we don't know yet how long those antibodies stay in your system and what kind of protection it gives you. So also out of fear of a false sense of security where somebody will say, oh, well, I have the antibodies. I'm fine to go and be around somebody that I know is COVID positive. We're assuming short-term immunity at the very least for people.
But we know there's news on that as well. Mass General just had something printed and sent out. I saw it in the news last night that the 87-year-old man that went home came back and tested positive again for COVID. So it does appear that even if you'd been a positive before, you can get this again.
You can get it
at
again,
least according to Mass General with this one individual study.
Yep.
So I know that there need to be peer studies done on that and a much more voluminous grouping of people. But just because you had it, don't let your guard down.
Exactly.
Continue doing the right thing, wearing the mask when necessary. Doesn't mean you can't get it again.
Right. Right, and it's a snapshot. It's a snapshot of that day that you have the antibody. What if 5 days later your antibodies have decreased and you don't have that? We don't know how. This is where all of these studies need to kind of go. And we're hoping in the next 6 months we'll have better answers and be able to drill down on that a little bit more.
So with all this testing, and it seems to be, depending where you go, how quickly to come back, what do you see are the challenges to testing? What is our hopes that they work out before the fall, which everyone's saying that we might see this come back in a more pronounced fashion. So can you share with us what challenges you'd like to see work out
Sure.
for testing before then?
So definitely. So, testing is one of those metrics that is being looked at and really drives the reopening and how we're going to be opening things with schools and, relaxing even more of the guidelines for businesses. So one of the struggles, and I've said it and I keep saying it, is just the inconsistencies and the delay in reporting because we can only manage what we know, and so until we know what the caseload is in the community, we're unable to isolate and unable to do the contact tracing, which is so important to this. So that being said, we've been using the contact tracing collaborative here in the state of Massachusetts, which was slow to get off the ground. So they're a group of people that do exactly what we've been doing in this community, meaning reaching out to the close contacts and telling them to go get tested and advising households on quarantine and isolation procedures. So they're doing all of that now. They've been brought quite a bit more up to speed, which has been nice. Really in the past, I want to say 4 to 5 weeks. So once folks test positive, they're likely to get a phone call from myself and also the contact tracing collaborative. Sometimes they beat me to it, sometimes I beat them to it, but and the more information that can get shared is always a good thing. So so getting people also comfortable with the other agencies that are working through this as well.
So the collaborative, how does that work? I mean, I always fear that if we don't have it here and we're not doing it ourselves,
Right.
that we lose oversight over it and we lose information.
Right.
Have you seen that as an issue with the collaborative?
Yeah, I think Winthrop, because we're a unique community and we're very interconnected, I try and put myself in somebody's position where if I had somebody calling my cell phone and asking me, for personal information of every person that I've been in contact with in the 5 days previously, I don't know if I would share that. I think that you should share it, but I think it can be jarring to people, which is why we've always maintained the ability to do contact tracing locally, as well as kind of using the collaborative as a backup. Our communication back and forth with the collaborative, it hasn't been established yet, but I think within the next week there's been breakdowns like within their system and everything else, but I think that all of that is getting worked out. So that's why I still think it's just as important to maintain the framework to do it here locally, because we have the advantage of knowing this community fairly well, and knowing kind of the idiosyncrasies of the people in our community and how to best address those.
Great. What areas, and I guess what class of people are high risk? We knew the elderly were high risk. Do you still see them as the high risk population, or has the high risk population changed over the time, I guess?
So it seems like right now our highest, so initially, I'll kind of walk you through that a little bit. Initially through March and into April, our high risk folks that were testing positive were definitely healthcare workers. They were folks that were in the custodial roles at the healthcare facilities, or just in other larger buildings. And then it kind of shifted through April. What constituted a very large part of the numbers were within assisted living facilities. We saw some spread upwards of 100% in some of the facilities. So that was a big risk. Now we're seeing it primarily spread between households and via congregate settings. So households are the number one area where we expect to see spread, just because by the time symptoms present, usually it's about 2 days later after first being infected. Then you've been around your family, you've been eating dinner with your family, you're sharing a lot of space with your family, you're relaxed with your family. So we definitely expect to see spread within households, which is why we mandate the quarantine. And then beyond that, the congregate areas that we have in town, we're very blessed to have beautiful beaches. And, I know Ural Beach has been a hot topic of debate since COVID really came about. But there's specific guidelines, and we're worried about how people are translating that, and are they actually doing it? And we've had plenty of reports of people not following the guidelines. So, just to reiterate that.
Parks and Recs has some Massport workers down there trying to help out, educate people on Ural Beach itself.
Yep.
I'm just as concerned with Shore Drive. That's under state control.
Yeah.
I don't see much monitoring on Shore Drive beaches, DCR Beach, or anyone giving out information. I have seen signs up there asking people to wear a face mask and socially distance.
Yes.
So Ural Beach is a town beach, and that's why we spend so much energy and effort in trying to enforce that beach. I know the council passed the pilot program for resident parking stickers 24/7.
Yeah.
From right after the handicap spots on Ural Beach all the way to the point. I've been down there the last several days myself. I have seen a decrease in parked cars in the Point Shirley area. So hopefully with that restriction and our information that we're getting out there, we can adjust people's behaviors throughout that. Anything you wanted to add on the beaches?
And so I like the way you said that, adjusting people's behaviors. That's a good one. That's what we want to do. We want to adjust behaviors, because what the guidelines say is that, and this is based in science. So this is based on what we know from COVID to date, what we know from other viruses that are in their same group. So it is based in a science. We're not kind of just pulling this out of the air. And, for groups that are visiting our beaches, if you are in your household, then you are able to sit together in an area of less than 6 feet while unmasked. If you're with folks that are not in your household, or constitute, if it's a mixed group even, of some people in your household and some of your friends, spread your chairs out greater than 6 feet, then you can take your mask off. If you are in a closer area, we see all the beach circles, right?
Yes.
Of people sitting in their circles down the beach. So if you're in that closer space, wear your mask. We want people to be able to go outside. Like we were saying, it's good for us all to be outside and be able to have a break from being inside. And
do you think people feel I'm outside, therefore I'm not going to catch this if I'm closer than 6 feet?
Yeah, I mean, outside definitely. We're pushing outside activities. We're pushing outdoor dining. We're pushing outdoor. We've even seen, some of the rec camps right now. They're erecting tents so that they can service the kids in the community and have the kids, go back to their summer rec programs. But they can't, with all of the protocols, they're putting some tents up so that they can house the kids during bad weather or as breaks of the day. So yes, definitely, people do think that. But it's not a fail-safe. It's not preventing. Just being outside does not prevent it. It decreases. It diminishes the risk of transmission. But when you're sitting in that close space with somebody, you still need to either wear a mask if it's somebody that isn't in your household, or spread out and have that 6 foot distance.
Now you brought Parks and Recs is back up and running, which is tremendous for people who need their children to go someplace while they work.
Yes.
And other camps, I think, have also re-engaged.
Yep.
Have you seen any issues? I know we can't talk about specific cases, but generally, has that been the driving factor, or has the age group not been that age group and not been associated with camps that have driven our numbers up in the last 10 days.
Yeah, so we definitely have seen, well, it's been either, through the contact tracing, we definitely had touch points on certain, in more than one rec program, more than one sports program for the summer, which we expected and we planned for that. So we planned for it under very strict protocols provided by DPH, EEC, just the governor's office in general has been pushing out very strict protocols. And the kids have been amazing, really and truthfully. Like that, it's nice to hear kids outside again, and kind of, they have to stay in their small space. There's no movement between counselors. There's no movement between staff. All of these programs had to upwardly staff for this reason, that if they lost one or two counselors, they weren't going to reintroduce a different counselor into the group. Like, it's really
So if
specific.
I'm a counselor, I'm at Ingleside Park with this particular group, let's call it Group A, I am there for the entire summer at Ingleside Park with Group A.
Yeah.
So I'm not going from Ingleside the next day to Massa or out to Pond Street. My assignment's my assignment.
Yep, exactly.
So that's to stop, in case anyone did get infected, any spread amongst the different groups.
Yeah, exactly. And I think that what we've learned, and I've spoken at length with the majority of programs, whether they're private, being at our yacht clubs, or more of the, like on the town side, is that we're able to do a great job of controlling the environment that they're engaging in, right? The difficulties is trying to assess what people do when they go home, what families do when they go home, and what staff do when they go home. That's what we don't have control over. So there is a screening process before work and before starting the camps most days. So that's a protective thing, a protective barrier that we've put in, and that's pretty much mandated by the state as well. So all of these are working in conjunction, and we, like I said, we've planned for it. We're using this information to inform the schools as to what's working and what has been a challenge. And truthfully, just I stand by just communicating as much as possible with people, being as transparent as possible to address the concerns and any sort of confusion, because it's hard. It's hard to take these next steps as we're reopening, and we're going to run into these situations where it's part of the reopening. We're not going to be able to keep everybody 100 to guarantee anything.
So we talked about beaches. We talked about park and recs programs and athletics. How about restaurants? They were allowed to occupy indoors in phase 3. How's it been going, and where do you see the issues there?
So I think that it's been going very well from all reports that I've had. Definitely have received a few complaints, a few concerns, mostly about whether staff are wearing their masks. We try to also help. We would also try to help any facility, any restaurant, any business where people are not complying with the mask order. Sometimes our hands are tied. If somebody has a medical condition that means that they can't wear a mask, then they can't wear a mask. So, and there's not much wiggle room on that.
And there's not any requirement for them to prove that they have a medical condition.
Right.
Under the current guidance and laws.
Right.
So we're operating on the conditions that we have constitutional laws that restrict our behavior, as well as some of the orders from the governor that allows a person who has a medical condition not to wear a mask. But if you have a medical condition and you can't wear a mask, then you shouldn't really be shopping. You should ask or try to get someone else to do your shopping for you.
Yes, yeah.
And I would imagine if I was a person inside a restaurant and I was serving food, if I wasn't able to have a mask on because of a medical condition, I would not be able to do that. That function.
Right, exactly. So, so really it's just about the masking has been, we've had a few Nothing that couldn't be dealt with, pretty quickly with re-education of behavior. So, and how important that is.
Well, I know we have Allergy and his team. They check the restaurants
Yep.
for you, and
Yep.
so when they go in there, they're checking for masks and educating people. So that's the first thing the health department did was the education
Yep.
process, is delivering notices and letting them know what they needed to
Yep.
do and what they can't do.
Yep.
And part of that is tables.
Yes. So now now that we have indoor seating, which we learned a bit during the outdoor seating. So so whenever somebody walks into a restaurant as a patron, we need to be wearing a mask as we enter the restaurant, as we walk to our table. Once seated at the table, we're able to unmask. If you have to get up and use the restroom or for any other reason, you need to put your mask back on. But while you're at the table, you're able to unmask. Tables cannot be for greater than 6 people. There cannot be any moving between tables. So for example, if I'm sitting with myself and my family at a table and I see you walk in with your family and you sit at another table, I can't get up and go over and talk to the Delehantys or join the Delehantys table.
So no lingering, no hovering over. Stay at your own table. Wave to people.
Yep.
Say
Wave to
hi to
people.
them, but don't get up and go over and shake hands and sit with them.
Right, exactly, because that is not socially distanced. And we know that bars are not going to be allowed at least until phase 4. So we don't want to create a bar-like atmosphere. We want people, we definitely encourage people to go in and use the restaurants. I was out at a restaurant last night, and it feels great to not have to cook every single night. But when you are at a restaurant, walk in, order a meal, help the business community, order a drink. If you're ordering drinks, you have to have food alongside of it.
Okay, so bars are still not open, and we won't see them open for a while.
Right.
The yacht clubs can do food as well.
Yeah.
And they have their own requirements, and they've been educated in those requirements as well.
Yep.
No sharing drinks.
No
and
sharing
no
drinks.
eating off each other's plates.
No. No.
Those are 2 things we definitely want to get out there.
Right.
6 people per table, no more.
Right.
How much a distance between tables?
At least 6 feet.
At least 6 feet, and
Yeah.
the pathway between the tables walking to the restroom has to be 6 feet as well.
It has to be 6 feet.
And that's why you see so many restaurants that have diminished capacities and that they can't really occupy to the levels that they were.
Right.
So that's even more of a reason for us to participate and try to help them out and try to get out as much as possible.
Right.
The couple of restaurants I've been in with and eating with my family have done a phenomenal job.
Yeah.
Everyone's masked, everyone's bringing the food over quickly, and no one's lingering around. So certainly, I'm happy from what I see from my perspective.
Yeah. Yeah.
But I know we've gotten some complaints, and those complaints have gone to Allergy
Yep.
to be handled, and hopefully through re-education, and we'll spot check these restaurants as they go forward.
Yeah, exactly. And I think, kind of to circle back around, I feel in my sense, it's almost as if the restaurants and the rec programs are a very safe place for us all to be because of these protocols. Really what's driving this is like the unregulated behaviors that we're all kind of engaging in right now. It's not from a restaurant not following guidelines. It's not from a rec program or the football team not following guidelines. Their guidelines are very specific and very detailed, and which is extremely helpful in this situation. So this is more the unmandated behaviors that we're seeing.
We'll get into that in a second. If I'm in a restaurant, I don't see complaints, who do I call?
So you can either call the Board of Health, which their phone number is 846-4344, or this is really being regulated through the Department of Labor Standards, and their phone number, which is kind of long, is 508-616-0461, extension 9488. And they also have an email, which is safepublicworkplacemailbox@mass.gov.
There you go. So you have the areas where they can report it if they see a restaurant not behaving in the fashion they should be. Let's move to the more unrestricted areas that we see issues were, and let's tell the viewers we understand as parents. We get those same issues that they're dealing with at their homes. We get at our homes, and it's sometimes hard to balance the containment of this COVID-19 with how to keep your kids entertained.
Yes.
And move through the summer and then try to be as normal as possible moving through a very difficult summer where they've lost a lot of things along the way.
For sure.
But everyone's lost something along the way, not just these kids, adults, and everyone else. The elderly, everyone has lost something. I think it's important perspective to remind our children that we're trying to keep them safe. And in order to do that, I wanted to talk about houses, and sometimes that was my house, don't tell me what to do. Sometimes we see backyards. So let's talk about those indoor spaces first, being in the house, because birthday parties come up and everything else, and we want everyone to be safe.
Yep, we do.
It's not trying to kill their enjoyment here.
Right.
So let's talk about if I have a birthday party at my house, what am I allowed?
So the safest practice is to keep it to less than 10 people because that's an enclosed indoor space. Or even your backyard, we consider that an enclosed outdoor space. It's not a free reign area because you have your neighbors on each side. So that's why it's defined as a enclosed outdoor space. So best practice is to keep it less than 10 people. We're not going to go into people's houses and start counting people. But we shouldn't have to, because this is to keep people safe. It's not to be the fun police. This is just really the practices that are going to be best for the community. So
we need every homeowner to participate, and everyone who has control over property, whether the homeowner or the landlord, to participate in trying to curb behaviors. In order to make sure the spread doesn't get any worse, and that we go back to our June numbers, which were about 5.
Yeah, they were 15.
15 total cases for the month.
15 total cases for the month. So, and when people are there, distance yourself, or if you're unable to distance, wear a mask, especially if it's somebody, that has underlying conditions. It's okay to wear a mask even if you're inside a house. If there's other people around and maybe you're concerned about of being in closer contact. So we want to keep it to less than 10 people. And really, I just want to drill down on the sharing of food. I find that to be, like a very high risk behavior, the splitting of beverages. But really, it's even something as simple as like your birthday party. We just went through this week with my own son's birthday. When you're putting traditional candles in a cake, nobody should be blowing out candles on a birthday cake.
That's a great point. I was at a party and they had a paper plate that the child waved to extinguish the candles.
That's
so no one would blow on the cake, and the cake could be then sliced up and shared.
Yeah, and what we've done in my house is we've cut the cake and then just put the candles on one piece, or have just moved to cupcakes.
Yeah,
Cupcakes
perfect.
for everybody.
Chips and dip.
Oh, chips
Everyone
and dip.
loves chips and dip.
Chips and dip are my most really stress me out. So yeah, that's like what we consider like that communal food. Anything that that somebody is putting something in their mouth and then re-grabbing down. I use chips and dip as like the example with that. So if people are going to barbecues or any sort of celebration or any sort of gathering, I encourage them to bring their own food even. Bring your chips and dip for you, and that's going to be your chips and dip. And then other people can bring what they like. It's kind of like bring your own food, bring your own beverages, and have like your own little contained picnic for you and your family, you and your household within the guidelines of 10 other people.
Great. Let's talk about that backyard again, because we've seen some numbers over the July 4th weekend in backyards that were way over this 10.
Yeah.
So what tell us again what the requirements are for backyards and why? I think everyone looks at a backyard and they say, this is an open outdoor space. And open outdoor spaces are treated differently than open enclosed spaces.
Right,
So if you, can you
exactly.
walk us through that?
Sure. So the reason why, so a backyard still has to meet the requirements of 10 or less people in a backyard. And that's because, well, first of all, Winthrop is one of the more congested communities. So, so our backyards aren't really that big. They might feel big. Some of them are bigger than others, but your neighbors would probably feel like if they're watching 50 to 75 people congregate in the property just next door to them, that they're not going to be happy about that. So that's why it's an enclosed space. You have a property line, and it's defined by your property line. So you have to be mindful of that. Whereas, you know, if you go down to Ingleside Park, Hannaford Park, that is an unenclosed outdoor space. So able to spread out more.
Because there's no neighbors.
There's no neighbors.
There's streets, then the neighbors.
Yeah, exactly.
So it makes it easier to add more people to that outdoor space. And let's talk about the enforcement matrix to all of this that we've been sharing with the community for the last half hour.
Yeah. So
what can you tell us about it? I know primarily the governor does not want law enforcement to be on the front lines of the enforcement aspect of this, but we are always there to support public health and the health director. So if you needed us, we'd step in.
Right.
But let's talk about the matrix.
Right. So, you know, we want to go through this as first off, offering some education to people, because that's truthfully how you change behavior, right? Is for there to be buy-in. We want buy-in from the community as to the behaviors like that we're all partaking in. So the first step really in the matrix that the Commonwealth has come up with for these guidelines and the governance of this has been you know, really reaching out to either the Board of Health, the Public Health Department, and, you know, raising concerns. We've definitely heard concerns on Ural Beach and in other parks in the community, you know, different streets where it seems like there was larger groups congregating. You know, the basketball courts, people were reaching out this week. So, so really it goes to the Board of Health and to re-educate people. And then, you know, if it's a business, then it goes more into if a business isn't complying, then there's a matrix of like cease and desist letters, and, you know, being able to really curb the behavior by shutting down the business, and then that's kind of where the police department would step in also. And, you know, there is a potential for fining, especially if somebody is in public without wearing a mask and doesn't have a medical condition, then there is the potential for fining in that regard.
And that's kind of the last thing we want to do.
Yeah, we don't want to do that.
As public employees, we don't want to fine the citizens of our town. But if they're repeat offenders, sometimes the educational model has failed, and we have to do a more of an enforcement model. So we ask everyone to just cooperate with us, listen to our advice, and help us diminish the rise of the second wave here locally. Would be the message on this enforcement matrix. You know, first responders, certainly we appreciate them. We work with them every single day, and we want to say thank you to them, but we also want the public to realize that first responders have been infected in this last wave of 48 people in the last month. And in order to keep them healthy and safe, we need your help to adhere to the advice and the conditions imposed by public health and the Massachusetts Department of Public Health. So certainly I hope we have decreased anxiety. We're hopeful that we have answered all your questions. Again, we'll reiterate some of the stuff at the council meeting on next Tuesday night. And I want to thank everyone for watching.